Sarah became symptomatic when she was around 2, and we went to the doctors and over and over and over again to the pediatrician. They tested the blood, and her numbers were extraordinarily elevated. Hi. Good morning. We're here to see Dr. Leitner.
What we saw on the biopsies was inflammation of your intestine, together with the fact that she's had positive blood tests and had some symptoms, virtually clinches the diagnosis of celiac disease. Celiac disease is a permanent sensitivity to a protein that's found in wheat, rye, barley, and to a certain extent in oats as well. This leads to an autoimmune problem with the intestine or autoimmune disease with the intestine. An autoimmune disease is when the body's immune system turns against an organ or tissue in the body inappropriately. In the case of celiac disease, that autoimmune response is directed primarily at the intestine, and individuals develop damage to the intestine. It's important to note that this is a permanent sensitivity. It's not something that goes away with time. The first step to make the diagnosis of celiac disease is to do a screening blood test. If an individual has a positive blood test, then they go on to the second step. And the second step is actually to look at the intestine, and that's done through endoscopy, where a long, thin tube is introduced through the mouth, guided down the esophagus, through the stomach, and into the intestine, and biopsies are done. Based on the biopsy results and the blood test results and the symptoms, then you can be reasonably sure about the diagnosis of celiac disease. When people eat, the food goes into the stomach, where it is broken up into tiny digestible particles. Those particles then travel through the upper intestine, where they are normally digested and absorbed through the villi. In the villi are millions of finger-like projections on the lining of the intestine that help in the absorption of food. In a person with celiac disease, gluten in the food particles damages the intestine with an eventual loss of the villi. This leaves a smooth intestinal lining that is no longer able to effectively absorb food particles and their contents, including nutrients such as iron, calcium, and vitamins. The major part of the care of somebody with celiac disease after diagnosis really is in learning the diet. This is not something that people can do on their own. You need help. The important individuals are not so much the physician, but the dietitian or nurse educator who will be a resource for the family. We also have a support group with families who have children with celiac disease. I find that the parents really are the true experts. There are newsletters, there are websites, there are a lot of resources. And what our job is to introduce you to this and teach you how to teach yourself.
The damage that you're saying that she has, is that reversible? Will it heal itself, or will it always be like that?
When Sarah goes on the diet, the damage will heal. So if we looked back in 6 months or a year and looked at her intestine again, it would be perfectly normal.
Is there a cure, or will there be a cure, you think, for this?
Currently, there's not a cure, although I have to tell you, even though there's not a medication for this, that may be a good thing, because every medication has a side effect. And Sarah's not going to need to be on medications to treat this. At this point, it's a diet.
Will she have a normal life?
I absolutely predict that she's going to have a normal life. Okay?
Thank you so much.
You're welcome. Good to see you, Sarah. Good to see you.